which I don't know if you know about United Healthcare, but they're the largest private insurer. So they have about 60 million lives. So 1 in 5 folks that have health insurance in America have United Healthcare. So it's a big chunk of the population. Essentially, this lawsuit says that post-Mental Health Parity Act, which was an act that was designed to bring mental health treatment, so that includes any kind of behavioral health care, substance use, major depression, acute psych, under the same guidelines as all other medical, like going to your primary care physician, getting treated for diabetes or other types of chronic conditions, and saying, look, we're going to treat mental health, behavioral health the same as everything else. That act came in 2008, and essentially this lawsuit says that from 2011 to 2017, even though United Healthcare said they were doing that, they created new restrictive guidelines that were outside of accepted medical practice to actually restrict access to care. And United Healthcare lost. So what the actual ramifications are unknown at this point. So there still needs to be an actual settlement. Some people think that there'll be a government monitor brought in to look over United Healthcare and make sure that they are, in fact, administering benefits in a way that actually helps people. Some people say that they're going to reprocess claims from 2011 to current, which would be devastating to United Healthcare. Regardless, I think it's going to pave the way for other payers to treat people that have mental health issues, whether it be substance use as applies to Delphi Behavioral Health Group, or acute psych, or autism, or eating disorder, or any of these other things, that people will get a fair shake, that it is a disease, that these are healthcare issues that need to be treated the same as other things. Sort of as someone in the helping profession, you sort of hope and believe, maybe naively, that everyone's approaching the problem sort of on equal playing ground. And you think that the payors are collecting premiums and they're going to pay them out and that you're going to do the best for your patients. And it's really disheartening to think that people were not acting in good faith. And I think what's devastating is all the folks that sought help from 2011 to current under United Healthcare and didn't receive it. And part of the lawsuit calls out folks that died that didn't receive help. And not saying that they would or wouldn't have passed, who knows, but it feels like they weren't given a fair shake. And it's devastating. You want to think everybody's acting in good faith, like we are, like other good providers are. And it's really upsetting to me as someone who's been in the helping profession for a long time, that these payors spend almost 10 years restricting access to care.